Hello and welcome to the United MAC Leading Edge podcast. Today we present another episode of our continuing series called Piloting Your Mind. I'm the United MAC spokesman, Captain James Belton. On today's Piloting Your Mind episode, we are excited to have two guests here, along with Captain Lynn Tatum from our SOAR committee. Lynn, can you open the discussion for us?
Thanks, Jim. I asked Dr. Quay Snyder to come on our episode and talk to us about pilot stress. I want him to also introduce how the FAA sees pilot stress and emotions on our job. Dr. Snyder will also educate the listeners about his company, AMAS. Both Dr. Snyder and AMAS is a big resource for SOAR. We want the listeners to be privy of that. We're also very excited to have one of our own pilots, Luis Perez. He's going to give us a pilot testimony and share with us his mindfulness techniques.
Dr. Snyder, it's great to have you on board today. Can you start by giving us a short bio of yourself?
Sure. Thank you very much for having me on. Like Lynn, I went to school at the Air Force Academy and I wanted to be a pilot. I was a CFI at the time in gliders, but I lost my pilot qualifications, so I had to go into my second career choice, which was medicine. The Air Force sent me to medical school and then was kind enough to send me to Korea, and I had a chance to get back into flying again. And that changed my trajectory from initially family practice ER to aerospace medicine. In doing that training, I had the requirement to do a master's in public health, which required me to rotate with industry. And they had an opportunity to rotate with the ALPA Aeromedical Office. I didn't know what ALPA was at the time, but I took the opportunity to spend a year working with them and really enjoyed what I was doing. The Air Force sent me back to Korea again. And while I was in Korea, I got a call from Dr. Don Hudson, who was the new ALPA Aeromedical Advisor, and asked if I wanted to join the practice. At that point, I had 17 years in the Air Force. I was close to retirement. I was really enjoying what I was doing. But I realized that this would be a job that I would enjoy for a lifetime. It was a dream come true. And so with the support of my wife in 1994, I elected to leave the Air Force at that time and join the ALPA Aeromedical Office with 3 other dogs. I worked as the Associate Aeromedical Advisor until 2010 when I became ALPA's Aeromedical Advisor. And we merged some companies, Aviation Medicine Advisory Service and Virtual Flight Surgeons. Aviation Medicine Advisory Service provides service to ALPA pilots at no cost for all of their medical certification questions, assistance, and advocacy. We do provide services for other groups on a fee-for-service basis to include other pilot unions, air traffic control unions, flight departments, etc. But ALPA is our primary customer, and my primary role is to provide aeromedical advice and expertise to the ALPA leadership, staff, and support the MECs, as well as administer the HIMSS program for ALPA in the FAA. It's a wonderful job. I absolutely love it, and the ability to work with pilots and keep them flying fulfills me every day.
Dr. Snyder, I have used personally ALPA Aeromedical on several occasions. You guys are great. I am grateful, and we are grateful for you setting aside some time today for us, and we look forward to hearing more of what you have to say. This is a great segue, though, for welcoming Captain Luis Perez. He's another one of our guests today. Luis, you have a bio I'm sure is just as incredible as Dr. Snyder's. Why don't you share with us?
Well, good morning, Jim. Thank you for allowing me to come in here, and also thank you, Lynn, and especially thank you, Dr. Snyder. I am a recipient of his services. My bio is not as great as Dr. Snyder, but I did start in aviation in 1983 when I started flying hang gliders in Argentina, in the mountains of Argentina. And then in 1987, I moved to the States, started working at first, just jobs at Disney World in Florida. And then I went to school, started my professional aviation in 1989. And I was very grateful and fortunate to join United in 1995. I joined as a 737 first officer. And then Later on, I would become an instructor in 1999, then became a captain 3 years ago, and I'm an LCA right now in the 757, 767 fleet. A year after joining United, on my first probationary PC, I stumbled in my first check ride, the one that everybody tells you not to mess up on. And that was my first encounter with the resources that we had. Luckily, I had a great fleet captain in the 737 fleet, and he pulled me aside and saw that in my initial training I had done very well. So he wanted to find out what were the extenuating circumstances of my troubles. And what he quickly found out is that there were a lot of external sources of stress. One of them is the family business in Argentina was going under, and that was quite a bit of a stress on me. And also, I had slipped through the cracks, and I did not get the initial CRM training. In those days, it was called CLR. Therefore, he pulled me aside, had me take the CRM course, the CLR course, and then had me do a whole PC again. But not before he recommended for me to see EAP, the Employee Assistance Program. At that time, the SOAR program did not exist. Otherwise, I would have gone to them. However, this was my first experience going to this resource, the Employee Assistance Program. I was not familiar with it until this fleet captain pointed it out. And to me, it was a great insight into all the help that we have, and to be able to just kind of open up to help. I think that's a very difficult thing to do, especially as a pilot. But it kind of set a path for me where in the future, when I had more issues that came up, I was able to rely on those resources and call them out. And one of them was AMAS, in which I'll tell a little bit later, but that was another resource that I used, and I'm very grateful for it.
Louise, thanks for mentioning that. I'm really glad that you mentioned that your fleet captain at the time reached out to you. That's great. Tribute to him. SOAR has a real good working relationship with the training center to encourage pilots to call SOAR at any phase of their training if they need help. So I'm glad you got that. We all know more now than ever that external factors can affect our performance in training and on the line. So it's good that you took advantage of that.
Yes, then you're absolutely right. As an LCA, I have seen how resources can help pilots, especially pilots in training. As I mentioned, I was an instructor. I was an instructor for a very, very long time, and I would be in a position to find out, and because of my own experience, I could see when pilots were having issues that related to something outside of their control, and I was able to kind of steer them in the direction of the resources, including SOAR. For my own experience, what happened later was in 2005. So this is about 10 years after being at United. Our daughter was born, and about a year and a half after that happened, my wife was diagnosed with untreated postpartum depression, chronic fatigue, and severe anxiety. And when we sought the psychologist to have her treated, the psychologist also diagnosed me with depression, and mine was reactive to her condition. We had spent 12 years trying to conceive when our daughter arrived, and ironically, the miracle that was supposed to bring all the missing joy into our lives was actually the change that triggered our depression. At the time, the psychologist that we were seeing, since she recommended medication for both of us, I did not want to take medication yet, knowing that the FAA at the time did not approve of flying with medication. So I said, I'm going to check with the Employee Assistance Program, EAP, again, to make sure that, the path that they recommend, to make sure that I don't get in trouble with the FAA. And that was, the reason why that resource, or a resource like SOAR, it's important, is because they understand our career, whereas other therapists might not. So at the time, like I said, the FAA did not approve medication. So the therapist recommended, the EAP therapist recommended that I try to find a program that used cognitive therapy. And she also recommended a book called Feeling Good by David Burns. And what I felt at the time when we found that therapist that used cognitive therapy, which, by the way, that therapist happened to be a professor at Denver University. So I felt more educated than I felt being treated. And the great thing, too, is I felt as we were getting educated, I felt as I was getting to learn the FMC of our brain. Up to that point, I felt that I was like flying raw data, you know, mentally wise. And I think also Dr. Snyder can give us a lot more insight onto, what's the status with the FA as far as medications is concerned, because that has changed over the years significantly.
Louise, you mentioned medications. Specifically, we're talking about antidepressants, correct?
Yes.
Okay. Just wanted to make that clear. Dr. Snyder, this seems like a perfect time for you to clarify some of the knowns and unknowns about pilots' choices in regards to cognitive therapy or drugs, antidepressants and such, and the FAA's considerations with our medicals. Can you enlighten us about that?
Sure, I'd be happy to. All of us in life experience different phases in the continuum of mental wellness, from being perfectly well to some minor stressors and inconveniences to perhaps something more significant, or as Luis faced something very significant in his life and in his family's life. And we move along that spectrum at different times. It's impossible to always be well. So what a pilot needs to do is make an individual decision about whether they're okay to fly. And I always tout the I'm safe checklist, which we all know: illness, medication, stress, alcohol, fatigue, and depending on where you look at, emotions or eating and hydration. But the emotions and stress part is certainly a critical point to assess, to make sure that we can do our duties as pilot in command or required crew member perfectly appropriately. And when pilots call us up about should I fly or should I not fly, we talk about the I'm safe checklist, but we also say, would you fly your family with a pilot who just described what you described? If the answer is yes, then you probably can go ahead and fly. If the answer is no, you probably shouldn't. But there's a spectrum of support that's available to pilots who are facing these challenges. And I'd like to compare this a little bit to a spiral dive in aviation. When you start to feel the G-load come up and the airspeed building up, psychologically, what you can do is you can release some backstick pressure and roll wings level and regain your psychological altitude before you've lost too much. And pilots are reluctant to call or to seek help, as was said, because their fear of medical certification implications of that. But I would encourage people to reach out for all the resources that exist. And really, there's a hierarchy of resources that we walk pilots through. I think the first thing that we would recommend is peer support. And ALPA has tremendous peer support programs for all pilots. The SOAR program for United is an outstanding one, as are the other programs that exist. Also, a person who goes and seeks help from clergy or EAP does not have to report that to the FAA. Likewise, peer support is not reportable as well. The next level that we would go to that does require reporting to the FAA, but is not necessarily grounding, would be that of a family or marital counselor. And in fact, if the counseling is purely for family business, family issues, or marital counseling, that's not even reportable to the FAA, as stated on the application. Once a pilot moves to a mid-level mental health professional for a personal mental health reason, that becomes reportable to the FAA, but isn't necessarily grounding. And most of these people are master's level and trained in cognitive behavioral therapy, which I'll talk about in just a second. With more significant conditions, a person may move up to get treatment with a psychologist who holds a doctorate degree, but does not prescribe medication. So it's possible to continue to see a psychologist and still fly. Another resource that people sometimes go to is the primary care physician. Primary care physicians are rather rushed and tend to prescribe medication because that's easy to do rather than spend the time sitting with someone. And then the highest level of therapy would be with a psychiatrist who may combine both psychotherapy along with medication. But let me talk briefly about cognitive behavioral therapy. If you look at the definition, it says it's a form of psychologic treatment that has been demonstrated to be effective for a range of problems, including depression, anxiety disorders, alcohol and drug use problems, marital problems, eating disorders, and even severe mental illness. There have been numerous research studies that suggest that cognitive behavioral therapy leads to significant improvement in functioning and in quality of life. In many studies, cognitive behavioral therapy has been demonstrated to be as effective or even more effective than other forms of psychological therapy or psychiatric medication. It just takes a while to kick in. But to simplify, I would say cognitive behavioral therapy is much like handling a warning light in the cockpit. We're left side of the brain type of people, we're checklist oriented. So when you get a psychological warning light, you would recognize that there's a problem. You do a systemic assessment of what's really happening. And is the plane or are you still flying psychologically? And then you use a checklist that the counselor has given you to address each of these emotions you have and to have a strategy to deal with those effectively without allowing the problem to get worse. And generally, this is extremely effective and in particular, effective for the type of personality that we as pilots have.
I really like your analogy, Dr. Snyder, on the spiral, because I have used that quite a bit. I'm very fortunate that I was taught early on to let go of the stick and let the airplane do its flying so that I can find resources. Because right after I, was completing depression treatment, and as you said, I did get to experience with my wife and my situation. We got to experience both the psychologist and the psychiatrist. Since she was taking medications, she needed a psychiatrist, and we were very, very fortunate to find a couple, psychologist and psychiatrist, so that we can work together. But right after I was completing depression treatment, I was diagnosed with a tumor in my sacrum, in my back, that had to be removed by surgery. Therefore, before I can return from flying right after depression treatment, I had to go straight into surgery, and that kept me off flying for a little bit longer. And that's when I came in contact with the process of Alpha Aeromedical and AMAS, your services, which for me that were invaluable. And that was the first time that at the time, you were working with
Dr. Hudson was the Alpha Aeromedical advisor at that time, and my mentor, and also a psychiatrist.
Right. So anyhow, so those were, again, other times that I got to use that. And at the time also, right after I finished, or as I was completing cognitive therapy, mindfulness was introduced to me as well as an additional resource that I could use. And the combination of the two, mindfulness and cognitive therapy, were very, very, very valuable to me, especially to come back to flying.
I would reinforce that CBT and mindfulness are both very, very effective self-administered therapies in many cases to help someone get back. It's always a pleasure to work with pilots like you, Louise, who are passionate about their flying and working hard to address their medical conditions and their mental health before it deteriorates, because then it's easier to get someone back flying. I neglected to mention a little bit earlier about the implications of medication, but when you first came to us, the FAA did not allow any use of psychoactive medications for depression or any other condition. It was in 2011 that the FAA began allowing 4 selective serotonin release inhibitors called SSRIs for pilots who have recurrent depression or major depression. There certainly are some caveats on that, and there's some hurdles in getting people to fly with that. But since then, we've had about 200 pilots who are currently flying on SSRIs now with a diagnosis of depression. So coming forward early is really essential. If we can get someone back flying with cognitive behavioral therapy or some other form of psychotherapy before they start on medication, that process is much quicker. However, if they do require medicine, the door is not closed. Pilots can return either on the medication or after a treatment period on the medication and stopping it and observing them for several months off the medicine to make sure they don't have a recurrence. So always a pleasure to work with the pilots and also the resources that ALPA provides to support all of our pilots.
Right. And you talk about medication and the fact that the way that I would say it is kind of like a last resort, in the sense that if we can use the other resources first, that will perhaps get us into flying faster. And for me, mindfulness had a correlation with medication in the sense that, when I was introduced to mindfulness practice in 2007, I was not as consistent when I first started. It was something that it was kind of supporting my cognitive behavioral therapy that I had done, but I soon started to realize the impact of it. Not only I realized the impact on mindfulness just on my personal life, but I also started to realize that there was an impact of it on my flying. And the reason why, it's because it basically tells us, to have an awareness of where our mind is in the present moment. And when I started to connect that when I was sitting in the flight deck flying, where my mind was instrumental to being more effective as a pilot, then I started to get even more interested and I started to actually practice it more. As an instructor at the time that I was, we had many incidents that we were having as a fleet, and I remember that I started to see the correlation between those incidents not being really training issues themselves, but actually where the pilot's mind was at the time that the incident happened. Because during those days, 2007, 2008, our fleet had a lot of very, very experienced pilots that had not been moving that much. So they were very experienced on the airplane and very experienced pilots as well. So there was a little bit of what pilots would call complacency. And what I realized that complacency is once we got automated on what we do, our mind tends to wander and get into the past and the future. And a lot of that has to do with things that are weird. It's correlated to anxiety, usually goes to the future and what we worry about, or it goes into our past or the things that we had experienced that we did not like that very much. So I started to see a great correlation, and I kind of called mindfulness mind essay, situational awareness of where our thinking is.
As an LCA, I concur with Louis. Now, as I mentioned earlier, with all the distractions out there, it's extremely important that we all stay focused when we're flying and mindful. This is similar to the high performance athletes that we can compare ourselves to.
Lynn, I'd like to reinforce what you just said about mindfulness. It's such a valuable tool in keeping us performing effectively. In this era of COVID, for most pilots, handling the stressors of the pandemic doesn't dramatically affect their ability to fly, but it certainly presents a new set of rules for them and their families to operate by outside of the aircraft. Many of us have practical everyday stressors that range from inconveniences to significant disruptions in our status quo. I love how Louise described mindfulness as mind SA. You're building an awareness of yourself and of external factors without judgment or emotion, and you're free of distractions. This allows individuals to better recognize what factors are impacting their lives and what reactions to those stressors are. Then they can deal with each of these systematically while the stress and anxiety are reduced. And although not technically accurate, I think of mindfulness as self-administered CBT. It's extremely effective. I practice it each day, although I'm sure I'm not as well practiced and effective as Louise, but that's what I aspire to.
Yeah, I totally concur with what you said, Dr. Snyder. And one of the correlation that I wanted to make too is that there's another component to it. One is the mind essay aspect, the situational awareness, but the other one too is the ability to take us out of our biggest drives, or I should say when our brains are being pulled away, or what we consider hijacked, when there's a situation like we get angry, or when we're actually under the influence of drugs. In my case, which happened later, in 2009, which is when I connected with you, Dr. Snyder, I had a tragic accident that put me in ICU with a broken back and many, many broken bones. After ICU, I spent 2.5 months at Craig Hospital, which specializes in spinal cord injuries. And there was, at the time, one of my biggest, I would say, obstacles, aside from all the broken bones and from the fused back that I had, was the severe pain that I was experiencing. And because of how they dealt with that both in ICU and then at Kirk Hospital, I was inundated with all kinds of narcotics. At one point, I was administered Dilaudid, which is, I believe it's a synthetic morphine. I had hydrocodone, OxyContin, and Neurontin, which is a neuropathic pain medication, all of those at once. And for me, in order to return back to flying, I needed to let go of those medications. And I was very, very fortunate that a friend of mine at the time came to visit, and he actually shared with me it was actually a CD, which was John Kavitzen's Mindfulness Meditation for Pain Relief. So even though I had been practicing a little bit of mindfulness, I think that one it actually forced me to practice it even more strongly. And also that in combination with biofeedback, which was, with the help of technology where I could actually practice mindfulness and see the effects of it on a monitor, I was able to slowly let go of the medications in order to return back to flying. And I remember very well that this is, when I asked for help, I came to AMAS, and once again, I got to work with you. I would say, actually, I did work with you at that time in trying to come back to flying. It was a 10-month long process for me because of I had to learn to walk again, I would say. But once I once I was released from the hospital, the FA required me to be 2 months off of Neurontin and then 1 month off of the other ones. And I don't think I would have been able to do that without mindfulness practice.
Absolutely. You are an inspiration to me, Luis. You did everything you possibly could to position yourself to regain your medical certificate, even at those early times when it seemed impossible. And I know the physical pain and the stress were tremendous, but the mental challenges you faced were even greater. You used all the tools available to keep your mind focused and your spirits buoyed. I remember you sending me pictures of your family and your hang gliding, and it had nothing to do with the certification efforts, but it spoke volumes about your spirit and your values and your desire to return to fly. So it was inspirational the whole time working with you. And I know you were greatly joyed when you got your medical back, but I was just a notch below that in my level of happiness and ecstasy for seeing you get your medical back. And it was a tribute to everything you did with mindfulness and your therapy too. So
I want to point out too, I know this is, you probably don't want me to put this plug in there, but I do want to say this because you're an inspiration to me as well. When I learned that as a Craig Hospital patient, you're very aware that Craig Hospital builds their whole therapy on their therapeutic recreational department, which is getting people to do what they used to do, even if if it's in different ways. So they had a really, really big insight on the mind and how it played it into the activities that we did. And when I learned that you were flying your glider and taking people from Craig, or taking patients from Craig hospitals up for rides, that was incredible to me. And as a matter of fact, it inspired me too, as well, to volunteer at Craig, after I went back to flying. Like I said, I had been practicing mindfulness more consistent, but I had never taken a formal course, formal training. So most of my training in mindfulness has been self-administered. I have used a lot of resources, including Headspace, the Waking Up application as well, in addition to a lot of books, and especially books on tape. And one of them that has been instrumental for me, it's called Fully Present: The Science, Art, and Practice of Mindfulness, which is written by Susan Smiley and Diana Winston, and they're both from UCLA, from the UCLA's Mindfulness Research Center. And then I have also worked with different organizations in the past 4 years to try to incorporate mindfulness into pilot training as well, since I realized that there is a big potential there. And there's still incidents that we had, especially, for example, with go-arounds, pilots that are unstable and do not go around. That's a significant issue with us that we haven't been able to correct over the years. And I believe that the reason it's because of where our minds get in that situation, how stressed we get, and we get into this process we call hijack. And I believe that mindfulness could have a huge impact on that. And I've been working on that for the past few years.
Louise, you have certainly had a tremendous number of experiences, and you can serve as an inspiration to all of our pilots. Now, all of our pilots won't share in what you've gone through, but we all have shared the experience of that check ride, and the most important check ride of your life is the one that you had the issue with. So anybody listening here can certainly take away that if you can get through it, they can get through it, and I appreciate that. With all of that, how would you like to end this, and what can you give us as a takeaway from your experiences?
Before the takeaway, I'd like to add to what you just said, because I did not mention, you hit on something that it's dear to my heart. You mentioned check rides and the stress of a check ride. As an instructor, we have a lot of times we have a little protocol of checking in with the pilot before they go into their check ride, and ask them about their life. Are they ready to go to the check ride, or is there any reason perhaps in their lives going on for which they shouldn't go into the check ride? And the majority of the pilots would actually say, no, I'm fine, and I want to, just go into the check ride. And over the years, I have helped through additional training a lot of pilots that actually went in, did not do good in the check ride, and then later when we're putting the pieces back together, they tell me, oh yeah, all of this is going on in my life, and but they were not willing to bring that up front. And so there's one of the big takeaways, I believe, through my journeys of up and downs, is that I have learned that the importance of reaching out early, as Dr. Snyder said. SOAR, it's one of those programs where we can actually talk to our peers in a confidential way. And it's very, very important to reach out, because as pilots, we always think that we have everything under control. We really want to control situations. That I think that's a requirement when we fly. But another requirement is to manage risk. And I think one of the biggest difficulties is to actually come out and say, I need help. I have worked with pilots that had no hesitations in flying into a war zone with a fighter jet, but they did not want to say, I need help. And I think that it takes a lot of courage to come out and say, hey, I cannot handle the situation, and can you help me? And there's so many resources, as Dr. Snyder already brought up, that we can use. As an additional resources with whom I became familiar in the past few months, there is the Mindful Aviator, which is also a available resource, and also Life Affect, which are services where we can actually call them up and ask for help as well. They tailor specifically to aviation, and they extensively use mindfulness as well.
I can't agree more with what Louise said, that we will all face challenges in our careers. Examples would include sick children, elder care, buying and selling homes. Unfortunately, furloughs for some. We're facing that now. Displacements, check rides, host of other things. And most of these, over 80% of these, can very effectively be addressed with peer support and won't affect medical certification. But the point that Louise made is critical. Reach out for help early. The ALPA peer support program volunteers are some of the best trained in the industry. And they're available because they care for the well-being of fellow pilots. Additionally, their training talks about the wealth of resources that are available to support a pilot in need. And some of these may be assistance with disability pay or interacting with a chief pilot to just get some time away. The effectiveness of peer support programs has been recognized internationally. I speak about it around the world, and EASA right now is mandating it for all of their airlines. We work collaboratively, both the medical professionals and the volunteers. We work collaboratively with all the other volunteers that exist, the SOAR program, the PAN program, the PATH, Americans Project Wingman. We're all in this to help pilots. And we work together like a good crew does to reach out to a pilot who may be struggling with life issues, to know that there's a wingman who's that peer support volunteer to protect their career and enhance their lives. Ultimately, our goal is for a pilot to have full well-being and to protect his or her career and enjoy what they're so passionate about, and that's flying.
In the midst of what's going on with the COVID pandemic and with historically large displacements and check rides that are going on, piloting your mind is going to be very germane to our pilots, and we appreciate all the help you've given us here. If anyone wants more information about the topics discussed, links will be added to the end of this podcast. Not only for information on AMAS, but Captain Perez has offered to speak with anyone who might want more information on his experiences. To our listeners, thank you for tuning in to the United MEC Leading Edge Podcast Piloting Your Mind series. To our guests, Dr. Snyder, Captain Perez, and Lynn Tatum, we greatly appreciate all of your hard work, especially your observations, insights, and professionalism. On behalf of the United MEC and all of our ALPA volunteers, fly safe and stay healthy. I'm Captain James Belton.